I'm Dr. Candy Marcet. I'm the new part-time medical director for the Edmonton Southside PCN. I started a couple of weeks ago, so a very new role, but I'm excited to work with our wonderful team and to help transform primary care delivery for our patients. We are very lucky to have a very robust quality improvement team at the Edmonton Southside PCN, and our improvement facilitator approached our clinic early in 2020 and introduced us to this technological advancement called CII CPAR, where you have this hub that was going to integrate information flow from the community EMRs to Netcare and back. So we thought, what a great opportunity, and we were reassured that it was going to be pretty smooth and easy with the support of our QI team, working with our clinic manager. And indeed, it was pretty seamless. The transition was really seamless. So if anyone is worried that it could be a struggle from one physician to another, it was actually a really streamlined process. The improvements facilitator got all the documentation ready, really informed our clinic manager of how this, got the PIA component on board, and then just really helped us with the entire transition. I don't know about the nitty-gritty details of the implementation because it was so smooth. That reassurance bit about it not taking a lot of time commitment and involvement was true. So I hope that's helpful. For anyone who's thinking about signing up for CII CPAR, it is worth all the benefits. There's so many benefits to CII CPAR, but I can talk about a few. So the CII portion allows sharing of selected information from our clinic EMRs onto Netcare. So any healthcare provider who can access Netcare is able to see when those patients went to their community clinics and for what reason. So it really helps keep everyone in the loop and then provide best patient care. The CPAR component allows us to really know who our panel is. So really get that patient attachment between the primary providers and the patients confirmed. This one gives us a really clear understanding of our panel patients. And it's really important because we need to know who our patients are to really provide best care for them. It's interesting because the CII CPAR has been so embedded that it's become part of my weekly, if not daily workflow with some of those e-notifications, which I haven't commented on, but that's another major benefit. So the e-notifications gives us this automated alert for any patient who accesses a AHS facility, whether it be an emergency, hospital admissions, discharges, day surgeries. So this ability really closes a major gap that's been in the healthcare system for a very long time. Before, the only way we would really know that those patients attended those facilities was if they came and booked a follow-up most of the time. Now we get alerts like twice a day that's automated into our EMR, letting us know, hey, this patient went to emerge, this is the reason why. So we can actually reach out to these patients and book a follow-up if it was necessary. So one example comes to mind. This past week, I had a patient attending the emergency for pretty debilitating pain on a Tuesday. I got the alert right away. I was able to review the emergency report, all the investigations, what was ruled out, the management plan from the emergency physician. And then by the time we talked yesterday, I already kind of knew what was going on and could corroborate her history with the information that I had, and then kind of understand that she was actually not adequately treated in terms of her pain, and then can move on to the next management step. So that's one, and these clinical scenarios happen all the time, so it's been a great benefit. CII CPAR is a provincial system that was developed in response to a request by family physicians to improve continuity of care for patients and address the sharing of information flow across the healthcare system. So if you haven't signed up but are interested, I would say reach out to your QI team and ask about it. If you don't have QI supports already integrated, reach out to your PCN. Every PCN is involved in enrolling physicians and clinics onto CII CPAR, and it really doesn't take a whole bunch of time commitment or involvement from the daily work of a physician. So I think it's a great idea to sign up. I recently just spoke with my clinic manager who really was instrumental in helping us get live on CII CPAR. And I said, how are things going? And she says she loves it, and she kind of runs the monthly reports to us. And now that we've been in the system for over 2 years, it's really just part of her workflow, and she says it's easy and doesn't take a lot of time out of her work as well. So if that helps, having an engaged clinic manager working with the QI team is really helpful. For anyone who's in the Edmonton Southside PCN, any clinics or physician who's watching this video and interested in joining the CII CPAR, just reach out to either your improvement facilitator or your primary care manager, and I'm happy to talk to anyone who has any questions as well about this process. So please let us know. Since CII CPAR, our clinic nurse, Pauline, whenever I get these notifications, if it's something minor, a sprained finger, I might just close that task and let it go. But if there's a significant reason for attending an emergency and the patient might be a little bit more complex, I'll actually send her the e-notification task, and she'll go into Netcare and review all the documentation and make a summary for me and send it back. So then I can decide if I need to reach out and recall that patient.